Hi, Dr. Gullberg here, continuing our internal medicine series. Today we're going to talk about depression and outpatient depression primarily. Um, have your patients take the PHQ-9 scale or the Beck scale to quantify the depressive mood disorder that they may have. Obviously, consult psychiatry and psychology if depression is moderate or more severe, so they can help. Certainly need to rule out bipolar disease, manic depressive illness, and look at the different types of depression, whether it be postpartum depression, seasonal affective disorder, reactive depression, or melancholic depression. Need to check metabolic profiles to rule out medical causes of depressive moods. And of course, then we look at medical therapy, which really helps about 50 to 75% of our patients. Tends to be more helpful in people with severe depression. So what are the different categories? Well, SSRIs, or selective serotonin reuptake inhibitors, have really been revolutionary over the last 20 years. Celexa, Lexapro, Prozac, Paxil, Zoloft are leading that category. We've also got SSRIs and 5-HT receptor agonists, such as Vibride. Then we've got serotonin norepinephrine reuptake inhibitors, including Cymbalta, Savella, Effexor, and Pristique. Next category is the tetracyclic antidepressants, which include Remeron. And then lastly, the norepinephrine dopamine reuptake inhibitors like bupropion. So the tricyclic antidepressants have been largely replaced, such as amitriptyline or clomipramine or doxepin, nortriptyline, and trazodone. As we look at all these different agents, what are they good for? Well, Celexa seems to be good in mild depression, especially in menopause and in elderly men. There's, however, less effect on anxiety. Lexapro seems to have a little better anxiety coverage than Celexa. Prozac is good for OCD as well as PMS, and it's pretty weight neutral, easy to wean. Paxil, of course, is best for panic, IBS, PMS, but very hard to start and hard to wean. Sometimes have to add a benzodiazepam with that initially. Zoloft appears to be good for anger and insomnia and good in the elderly. And of course, Cymbalta is good because it helps with people who have chronic pain syndromes. Savella has been marketed for fibromyalgia use, but fatigue is a big side effect there. Effexor is also hard to wean, but it's good for hot flashes. And of course, Remeron we use in the elderly, and it's good for people who have insomnia. So this is kind of a summary of the antidepressant agents that we use. Some tips on using that PHQ-9 scale or the Beck scale in the office so you can monitor a response to medication. Remember, the psychiatrists are always there and the psychologists to help with counseling.